And it's okay if you don't applaud. I don't take any offense because that is a modern teaching to us people, okay? But I do like sign language. Okay, so I'm going to introduce these next three presenters, speakers, and even though Medea is there and ready, I'm going to do her last. So here we go. So we're going to be hearing from Sherry Wabiska. She's an expert in program delivery and community engagement, bringing nearly 2 decades of experience from the Yukon government. She combines professional excellence with a deep-rooted connection to the Champagne and Ajac First Nation Wolf Clan. As the program officer, Sherry is pivotal in engaging in onboarding communities as part of the wastewater program expansion. Sheesh. Next, we will also have Dr. Carolina Koutras, PhD, and she is a biomedical scientist and change maker dedicated to creating a world fueled by scientific impact and innovation. Before joining One Yukon in 2023, Dr. Koutras founded Heroes Biotech, a company committed to advancing animal health through technology development. She has a background in health, innovation, and infectious diseases, and has also successfully led global science and research and development initiatives across institutions. Dr. Koutras holds a PhD from University Laval and a BSc from Paris Descartes University. And last but not least, we have Medea Alatini. She is a dynamic individual known for her energy, action, and integrity. She is deeply rooted in her heritage as a Southern Shoshone matriarch and a member of Kluane First Nation. Her experience with both traditional Indigenous and modern lifestyles provides a strong foundation for all of her endeavors. Medea has a Bachelor of Commerce from the University of Victoria, which has supported her multifaceted experience that spans sectors from tourism, mining, finance, and nonprofit organizations. Her tenure with the Federal Department of Indigenous and Northern Affairs Canada, INAC, in British Columbia solidified her proficiency in infrastructure, green energy projects, and treaty relations, cementing her reputation as a skilled relationship builder. As the former chief of Kluane First Nation, she worked with 2 councils to develop and implement a vision of energy, self-sufficiency, and economic resilience through strategic partnerships and collaborative efforts. Currently, she is the chief strategist of her company, GSD Strategies Incorporated, which has honed her ability to navigate complex, multi-partnered initiatives and deliver tangible results, a testament to her reputation as a leader who can get things done in a good way. Today, her adept leadership and no-nonsense approach to producing results are now channeled towards uniting communities and stakeholders to build a stronger, healthier Yukon through her position as CEO for One Yukon Coalition. One Yukon's mission is advanced by initiatives like the wastewater monitoring program and community-based testing that are designed to foster emergency readiness and health awareness across Yukon communities. These game-changing strategies will empower communities and ensure a sustainable future for the Yukon territory. So, Gnachish.
Thank you. Hello, Dunjay. Good to see you. And how's everybody's energy after your break? Good? Woohoo! Sherry would join us, but she's getting some stuff done in the background. We've got a shipment coming in that's in crisis right now. So we're just gonna roll with it. So we had planned to have Carolina and Sherry up in Dawson doing a demonstration of our GeneXpert device. And I'm sorry for those over on the other side, but you're not going to be able to see the GeneX device demo very well. But hopefully you'll be able to see it on the screens. Okay, we're gonna just do an overview of the work that One Yukon is doing right now in the territory. So we're fairly new, a year and a bit old. Dr. Koutras is hiding behind the screen. Carolina, she's like, don't call me doctor. So we want to give a brief history of how we got started. So back during the pandemic, we had been working, so Carrie Johnston and I were contracted under CYFN to do the First Nation COVID response. We ended up doing a lot of that liaison work between the First Nation governments, territorial government, federal government, and really at that point, bringing the grassroots voices to the governments and saying, this is what we can do in order to respond to the needs in our communities. Post-pandemic, so March 2022, it was a decision we need to branch out of CYFN's umbrella and continue the work that we were doing under the new entity, One Yukon. So there's no way that I can read that. So holistic partnerships, these are the foundations that we're really looking at, is how do we build those partnerships that are respectful, that are driven from our communities and really meeting those needs that we see in our community. So the data sovereignty is one big gap that we're seeing. We know that we're in the midst of health transformation, and ensuring health equity is one of the measures that we want to make sure that we're tackling and filling that gap. And then independent health advice. We had a bit of a challenge during the pandemic. Yes, the CMOH, who's now our MP, Dr. Brendan Hanley, was very willing to work with us, but he was giving advice directly to the minister, not directly to First Nation governments. And I think there's that gap there that we really have to address. And so we wanted to be able to get independent advice that our First Nation governments could follow up on, or seek and get guidance on how to keep our communities safe. So that is kind of what the gaps that we were filling. This is our board members, and we really pride ourselves on having a First Nation-driven board. So Jerry Lee Bike from Mayo, Nacho Nayak Dunn, Amanda Johnston from Liard First Nation, Carrie Johnston, not from First Nation, but we like her because she's got the Johnston last name. Allison Perrin, whose PhD is don't mention it. She's like, just about done. We're going to call you Dr. Perrin pretty soon. Alison Cormandy, who is from Dawson, from Trondheim. And then, of course, our staff members are Carolina, Sherry Wabiska, who's also Champagne-Ajac. Mohammed Karbouche is one of our epidemiologists, and he's based in Ontario. Our other epidemiologist is Justine Amon, and she is in Ontario. I don't remember all the towns. And then Katie Gregg, who's our Amazonian at the back over here, our newest import from Ontario. So really dynamic team, a lot of skills, and it feels like a powerhouse team that is pulling together and doing a lot of amazing things. So our partnerships, this is all foundational on partnerships. So we have partnerships with First Nation communities and the municipalities, and that's a little bit different because we see that in the territory, it's either First Nation driven or it's municipality driven, and it very rarely do you see initiatives that are driven by both or partnered by both. And this is not necessarily an infrastructure project, it's a health project, which municipalities don't really have a jurisdiction on. So we bring those parties together. We have data sharing agreements, we have participation agreements, and we also have to look to the rest of Canada for expertise. So this is where we leverage a lot of Carolina's relationships with labs throughout Canada. So we work really closely with the BC CDC, so BC Centre for Disease Control. And I was like, oh, we need a relationship with Alberta Centre for Disease Control so we can say we work with ACDC. But we don't. We work with Aqua Labs, is out of the University of Calgary. And Fiona Brinkman's at SFU. We have a partnership project with them, Genome BC and Genome Canada, Indigenous Services Canada, Public Health Agency of Canada. The National Microbiology Lab has been, and that's based out of Winnipeg, has been instrumental. They are the only level 3 lab in Canada. So we got to tour there, get into those hazmat suits, and it was pretty cool. And they will do tours if you ever want to go and check out the lab in Winnipeg. They do a lot of our PCR testing, and they verify the data that we're getting. So it's a very close relationship, and that has been developed throughout the pandemic. We also work with Reach Nexus, which is a independent agency based out of University of Toronto, St. Michael's Hospital, and De La Toya Labs in Ottawa, Heather Kale, which is with the Mi'kmaq in the East Coast, and in Miramichi, New Brunswick. So this is a really quick slide that I'm just going to go through. A lot of this was driven from our disproportionate effects of COVID during the pandemic. So we saw during the pandemic, when we first had our real spike of COVID, that 56% of the cases were Indigenous. 63% of the hospitalizations were Indigenous people. 56% of the medevacs, 50% of the deaths, and we only, at that time, made up 22% of the population. So you know that there's a gap in the healthcare system that is when you see that massive disproportionate effect. So we had to be able to reduce stigma, talk about these things. How do we reduce the barriers to achieving health equity? What does health equity look like? And how do we do that in a culturally safe way? And those are things that we grapple with every single day. And try to address systemic biases. So a lot of the work that we do is lobbying and having discussions, talking at national conferences or with scientists on working groups, and really bringing forward a perspective that is, I think it's common sense, but other people are like, oh, that's new. Oh, we should be talking to community. I'm like, yes, how about build a relationship? Anyways, that sounds so sarcastic. The other piece, the biggest piece that we're doing is wastewater monitoring. And so I'm gonna turn it over to Carolina with her sore throat to talk about what the wastewater monitoring program looks like.
And I don't know that I can read this fully, but the wastewater program is really our flagship program. It's where really we started in collaboration with support of CYFN. And right now we have a total of 6 communities and municipalities on board. And we don't have a lot of time here, so I think just wanted to say would love to connect offline and just give more detail for those interested. But wastewater has many advantages to it. Wastewater monitoring. The main reason why we do this is that we don't need to go and test individuals, which is very challenging to do and has a lot of ethics questions, and also even just accessing those individuals. So with wastewater monitoring, whether there is a wastewater system, which is what we call a catchment. So for example, in Haines Junction, the Haines Junction catchment is where like all the wastewater passes through the lift station. We go there, we grab a sample of that wastewater, and we have a representation of the entire population that is not only living there, but working and playing in that area. Not by hand. So we actually have really sophisticated, we call it a grab sample, but we actually use sophisticated technology, which we call the auto samplers, and essentially we install devices that are just a little bigger than this one, and they will capture the wastewater in a programmed way, so we have enough samples on a weekly basis and really good data. And we can look at a number of different things with wastewater. We started the program out with COVID-19 and other respiratory viruses, which still have a really huge burden in our society in general. But we have branched out since, and we have piloted substances of potential abuse, and that is, substances such as opioids. And that allows us to know what's happening in that region and how we can work with our local partners to target campaigns, educational campaigns, and even just provide supports like naloxone kits. And we can also do wastewater monitoring for other target pathogens that disproportionately impact Yukoners in our communities, for example, syphilis, which is something that we're doing as well. So this is just an overview of all of the communities and municipalities that we have on board. And like Mathia said, for health programs, it's kind of unusual to see the two, but because the catchment usually is in the municipality, but it's serving both the community and municipality, we actually have this unique model where we have Haines Junction, Champaign on board on the same agreement, and the government of Canada funding it, but the data sovereignty aspect of it is very important. So only the community can decide how this data is used in action done.
Yeah. So this is some of the media coverage just on the wastewater program in the territory. And this is some of the comms that had been used during the pandemic just from the First Nation. So if you look at that, it's Cole Paul's graphics. So they integrated community messaging in, and the nation was able to say, okay, this is the level of COVID, flu, RSV that we're seeing in our population, mask up. Or we've got COVID tests for distribution, or if you need some hand sanitizers, or you need a isolation kit, do you need some supports? So it really allowed the governments to meet people where they were at the time, and really with our vulnerable elderly population in First Nation communities, we really want to keep our elders safe. So, and young babies, young mothers, or like people who are caregivers that have young children, they have to be able to keep themselves safe. So this was an excellent tool that gave real-time results. And this device here is called a GeneXpert device. It is the same device that is used at the hospital at Whitehorse General. So this device is a qPCR machine. I don't have all this. I sound like a scientist. Not. But it is the same device that the hospital, when you get the swabs up your nose, the swabs are then put into these little cartridges. Those cartridges go into the GeneXpert, and within, I think it's 10 minutes, 10, 15 minutes, we're able to get the results in real time. So we have 7 of these devices, and they are right now being used for the wastewater program and being verified in at the National Microbiology Lab. So it's amazing technology. Health Canada, or the Public Health Agency of Canada, FAC, I have a little giggle every time, uses these devices globally for the detection of AIDS and other transmissible diseases in developing countries. So Africa is a big distribution point for these GeneXpert devices from Canada. And during the pandemic, the leadership at the National Microbiology Lab thought it would be a really good thing can we take this into our rural remote communities and see if we're able to utilize this technology to meet the needs of our First Nation communities. So ideal scenario, I know this is targeted towards youth. This type of equipment, you can get trained on it from the National Microbiology Lab. You can be a lab technician. You don't have to be a nurse. You don't have to get all kinds of years of training in order to do this. It's really I'm trained. honestly. God, 3 hours of training. It's fairly intensive. I mean, you're dealing with biohazard material, or you could be. So this is an opportunity for you to get that type of training. And right now we're only using it in wastewater, but the normal setting or the normal use for it is clinical. So you could be trained on this, and you could be using it in the underneath the new health authority. As a clinical technician. So the nurses can pull the samples and you could run the samples as a technician. I'm going to say that a lot of times, I say it all the time, but this is really what could be the integration between the healthcare system now and actually involving communities and community populations in our healthcare. So no waiting for 2 weeks to get blood results. It doesn't have to wait for a drive to Whitehorse. You can run those samples right there in your community.
And one of our operators in Haines Junction site is a young operator. So we do want to continue to work with youth in like training and actually having them as employees as part of this program. So Phoenix with Donix is out of Haines Junction.
Yeah, and it's great having youth involved because they pick up really quickly and they're efficient. I don't have to give computer lessons. It's great. So the other equipment that we use that is cutting edge is called the Kraken Sense, and this is the whole auto sampler, GeneXpert. It's all in that one box. We've got this equipment. That's what's being shipped up today. That's why Sherry's not up here. She's dealing with that shipment. And the ideal scenario is this is automated and you can get real-time results. The results show up on your cell phone right away. So you get data dashboard right immediately, and you'll be able to see any changes, any issues. The amount of, we do have a poster for this, and we'll put it up afterwards, but there's a bunch of illnesses, I'm going to let Carolina talk about that.
Like the GeneXpert, actually, these devices are versatile. So we started out with COVID and respiratory viruses, and we can do syphilis, and we're working with the De La Tolle lab to develop protocols to do tuberculosis and other important illnesses as well. The nice thing about the Kraken device is that, again, we know all of our communities are unique, and so in some of them, they are really remote. This device, and even, you don't have a local technician or a local setup to do this, so it's nice because we can just install and leave it there, and we'll just be doing everything automatically, automated.
Mm-hmm. So did you want to go through the dashboard really quick?
It's up to you. We don't have a lot of time.
No, we don't have. We got 1 minute left. So a lot of this, like the power of all of this information really comes down to, so what? So what are we going to do with this information? We have been, through our epidemiologists, they are so good at crunching the numbers and presenting it in a way that is usable. So we created these data dashboards that integrate all of the data between our GeneXpert device and what the National Microbiology Lab is bringing forward. We're able to share what the variants, so the variants of concern, you guys remember that. There's still a lot of COVID out there, so we are still tracking it. This gives us the timeline of the data that we're seeing, COVID on the top, flu and RSV on the bottom. And I think you guys will remember right as soon as the pandemic was declared over, people started getting really sick with RSV, and RSV is just as serious as COVID. So being able to track that as a respiratory illness, if you have, if you're immunocompromised or you are a small child or you have asthma, you want to be aware of what's transmitting out there in the general population. So this is very helpful for decision-making at a community level. And we're able to do trend analysis. There is on the data dashboard, there's an FAQ, which guides the users on how to read the information. And then the other big piece that we're doing is substance monitoring. When we initially brought this forward to leadership, it was how can we use this to save lives around the toxic drug crisis. So when you think of what we're seeing out there right now, we're able to track through the partnership with Aqua Labs, we're able to track substances such as, I'm gonna skip through all of this because, oh my gosh, we know that there's a health crisis, a toxic drug crisis here in the territory. We're not unique. This is very much a global issue, and we're feeling the brunt of it here though. So what can we do? We're tracking the substances of potential abuse, so SOPAs, new acronym for you. This information is, I think we have, I'm going to go right to this. This is the substances that can be tracked by the SOPA program. And we're seeing and able to verify right away that xylazine is showing up. We haven't seen ketamine. That is kind of a global thing that's happening right now, lots of ketamine. But the things that are showing up that end in the zines, those don't respond well to naloxone. So that we're able to verify that the drugs that we're seeing in the wastewater or when your body processes it, it creates a metabolite. And when we track those metabolites, we're able to say, okay, in the wastewater, we're seeing this type of drug being consumed. Then we're able to say, you know what? You need at least 2 naloxone kits and a quick response from EMS in order to revive and stop an overdose death. So being able to have that and converse with public health and with Blood Ties for Directions, the community outreach from KDFN, that type of information does save lives. So it's important, and I think we're seeing that on a global scale. The other piece that we are venturing into with the Simon Fraser University project is an eDNA. And I think this is the most exciting opportunity upcoming for youth to be involved. We really are hoping that we'll be able to bring the eDNA project in conjunction with the Land Guardian program or other environmental monitoring programs so that we're able to track what eDNA, if you think of, you guys have all heard of H5N1? Sounds so tragic, I'm like doom. But H5N1 has now tracked into British Columbia. As of last week, there is H5N1 being shown in the poultry farms in BC, and it will end up here eventually. So being able to track eDNA and see what is coming is one of the powers of this type of technology. So this is venturing a little outside of wastewater, but when you think of water holistically, we should be looking at wastewater, at environmental water. So think of the things that are happening up at Victoria Gold, and this type of monitoring where we're looking at what species are coming in. We know we got deer coming in. We've got cougars here now. What are they bringing that is different to our environment? And then, of course, we talked a little bit about STBBIs. Carolina, one of the things that we do with the National Microbiology Lab is the bringing forward rapid testing. So everyone remembers the rapid tests for COVID, up your nose. Well, we've been working with the National Microbiology Lab to bring these things, it's called an InstaTest, and you can test for syphilis and for HIV with the prick of your finger. These are point-of-care tests, so it has to be done by a nurse or a healthcare practitioner, but it gives you your results in, I believe it's 1 minute. You can determine whether you have syphilis or HIV in 1 minute. And that is life-saving, obviously, because you can be connected to care. But we're seeing in the territory, we had 2 cases of congenital syphilis this past year. And that is very detrimental to the lifespan of a child. A lot of babies that are conceived, and if the mother has syphilis, they don't make it to full term. Or if they do make it to full term, they're stillbirths. So it's really important to get tested and treated because it's antibiotics. It's a thing that can be treated with antibiotics. Not the nicest treatment. It's a shot in the butt, apparently, but they'll give you some lidocaine. But we know that being able to test and treat is something that will save lives. So all of this stuff, we've been doing that tagline of bringing life-saving technology to the comfort of your home. This type of technology, there's an HIV self-test, which is by the same company, Biolytics, that we have available that is a self-test. So if you wanted to know your HIV status, we partnered with ReachNexus on I'm Ready, or Ready to Know is the website, and you can go on that website, you can order it, and they'll send it to you directly, or we distribute it with Blood Ties 4 Directions. We're all about empowering change, community engagement. This is one of the foundational pieces of being respectful, engaging community, communicating what we're doing, and doing it with humility. I think this is one of the biggest pieces of how do we break down these barriers? How do we break down the stigma? And a lot of it is just having humble conversations, respecting people and having these conversations in a very candid manner. Talking about syphilis shouldn't be a big thing. Like HIV shouldn't be a big thing. There's a campaign out right now. If you have contracted HIV, you can get treatment, and if you're undetectable, if your levels are undetectable, you are not transmissible. And that's mind-blowing. Like that, we've got that much science. This is another partnership. I encourage you to take a photo of or try to pull up that QR code, because this is a new resource directory. It's called Ask Auntie, and it also brings you to our website, which is the Parents Like Us website. We have a chat bot there that will connect you to resources, and we're always looking for more resources. So this is the Ask Auntie website. We wanted to make sure that it was approachable and that people would be able to find the information that they needed.
So there's a chat bot that you can just ask a question.
Yeah, so at the bottom there you can see, hello, welcome to Ask Auntie. That's the chat bot. And you can ask it anything. Can I get HIV tested? Or I'm sure there's things that it won't get stumped. Oh, the QR code, yeah.
The cards.
We did put cards on the tables. So Katie put cards on the Ask Auntie little business cards on all the tables, I think. So that, guided by community, connections, pathways. Okay, this was supposed to be a 45-minute presentation. This is us. One Yukon. Yay! Thank you.
Awesome. And 3 minutes to spare. Okay, so it is that time for us to eat. And so what happens is we have break for 1 hour. So that means at 1:15, you got to go back to your sessions, okay? To wherever your sessions are, whichever ones you're choosing. And also housekeeping is when we are done with our food, we are not being served or cleaned up after, so we put our dishes off to the side here, and that way it gets dealt with over there. So by all means, everybody, enjoy your lunch, and Chish for the great presentation, and Suye Kwasatin. I'll see you guys all soon.